Hello guys, welcome to Luminous Med E Clinic. My name is Dr. Emmanuel Okore. I'm your medical tankraya. Globally, everyone have rights as enshrined in the fundamental human rights, which is legally binding. Some of which include rights to life, rights to the dignity of the human person, freedom of association, of religion, and so on and so forth. Medically, every patient have rights. These are entitlements of anyone seeking for healthcare services, whether in a public or private sector. As a medical tankraya, it is my duty to bring this to your knowledge. So within the next few moments, we'll be discussing the top 10 rights of a patient. Stay tuned. The first right we'll be looking at is right of access to healthcare, irrespective of creed, ethnicity, religion, political affiliation, sexual orientation, or even social class. Everyone is entitled to access healthcare services. It will be unprofessional for a facility, for a health facility or a health caregiver to deny a patient access to a healthcare services, especially if they can offer such services. Yes, we know that there are instances whereby the health need of a patient may be above what a particular health institution can offer. It now behooves on the hospital to refer such patients accordingly. Having this knowledge will, in a very great way, increase the health-seeking behavior of so many people out there. It is your right to access healthcare services. The second right of a patient that we'll be looking at is right to be treated with respect and dignity. And I add, no matter the diagnosis. Yes, outside the purviews of a hospital, we have people that can discriminate against some people by virtue of their health condition. In a hospital, everyone is treated with respect and dignity, and it even happens to be part of the fundamental human right of everyone to be treated with respect and dignity. So if you are in a health facility, let's say you are in a hospital and you feel like you were disrespected or that you were not given the dignity accorded to you, it is now your responsibility for you to escalate to the management for redress. Because as a patient in a hospital, it is your right to be treated with respect and dignity. No matter what your diagnosis is, no matter the social class, no matter the religious inclination or sexual orientation, it is your right to be treated with respect and dignity. So we have number 3, which is right to privacy and confidentiality of medical information. Okay, if you walk into a hospital, whatsoever you discuss with the doctor stays with the doctor. Whatsoever information you give to your healthcare team, that's your caregivers, stays with your caregivers. Okay, you will not, it will be wrong, it will be unethical, it will be unprofessional for a third party to hear of your medical information. All right, that is why people trust health caregivers so much. People trust doctors so much, because whatever you tell a doctor, he's not going to divulge the information. Okay, you will not hear it outside that, okay, Mr. A came to the clinic the other day and said that he has multiple sexual partners. No, whatsoever information that you give to a doctor, it stays with such doctor. If as a family man, you don't want your wife to be aware of your medical state, no one will tell your wife. It will be wrong for a hospital, for a caregiver to divulge your medical information to a third party, even if such person happens to be your spouse. I have been in such situations before, all right, where I have to withhold medical information from someone's spouse. Okay, because I know it's their right. If they want to tell their spouse, they should tell their spouse. So if they say doctor should not tell their spouse, who am I to tell them? All right, my license is very important. I don't want my license to be withdrawn, because if a doctor divulges information that he's not meant to divulge, his license can be taken away, except in cases where the patient is unconscious then the people that brought such patients can be privy to the patient's medical information. But if the patient is conscious, oriented in time, place, and person, not a minor, does not have any mental challenges, such person's medical information stays between him and the caregiver. The fourth one we'll be looking at is right to be informed of the diagnosis, the treatment plan, the protocol, and even the cost implication of treatment. Now imagine you were admitted in a hospital and maybe you spent 24 to 48 hours and someone asks you, hey dude, what are you being managed for? And you say you don't know. It sounds crazy, right? Yes, because you ought to know. It is your right to be informed of the diagnosis. It is your right to be informed of the treatment plan, of the prognosis, that of the eventual outcome. No matter how bad it is your right to know. It's also your right to know the cost implication so that you wouldn't receive treatment that you cannot properly pay for. For instance, if you don't know the cost implication of a particular treatment that you are going to receive, how will you know if you can afford to foot the bill or not? So it is your right. Now, any facility that you go to and they just keep giving you medications without telling you exactly what is wrong with you, you have to run, because you can't go to a facility and they are doing trial and error treatment. No way. It is your right to know what is wrong with you. So we're going to be looking at number 5, which is right to be informed and consent taken before any procedure. As long as you are conscious and oriented in time, place, and person, as long as you are not a minor is someone who is not up to 18 years, right? As long as you are not unconscious, as long as you can still make decisions for yourself, it is your right to be informed and consent taken before a procedure. Let's assume that maybe a patient walk into a hospital. This patient have a very bad diabetic foot ulcer, which is only amenable by amputation, right? Now this leg has to be amputated. That is the remedy. Even at that, such patients has to be informed and consent taken before the procedure is done. If such person is informed and he or she declines to give consent, nothing can be done. For instance, a woman is in labor, has been in labor for a long time, and doctors concluded that this lady is going in for emergency cesarean section, and such has been explained duly to her, and she understands why the emergency cesarean section has to be done, but she declines. Nothing can be done. Nobody can force you to have a procedure that you have not consented for. Now, if a health facility try, of course, no health facility can try that, because they know that should that happen, they can be dragged to the mud. That is not the case for a minor. For a minor, it is the guardian who can give such right. Before we continue, kindly subscribe to this channel if you've not done so, and give us a thumbs up. It is your right to know the safety dosage, the potential side effect, as well as the duration of any medication that you are given in a hospital. There are some facilities that may give you drug and they will peel off the drug labeling so that you will not know exactly what drug you are being given. That is so wrong. Now, I will not advise you to take any medication whose name you don't know, whose side effects you don't know. Now, let's assume that you took a particular medication and you're not even aware of the names of these drugs, right? And you have adverse drug reaction. How would you know the drug so as to avoid it next time, especially in cases of life-threatening adverse drug reaction? So it is the right of a patient to know the drugs they are given, the safety dosage of the drug, the potential side effect of the drug, as well as the duration, that they are to take such medication. It is your right. Right number 7, right to be involved in the decision-making process, as well as right to seek for second opinion if need be, except in cases where the patient is unconscious or not mentally stable or a minor. But if the patient is conscious and well-oriented, it is such person's right to be involved in the decision-making process. There are some disturbing medical condition that a team of medical experts have to, deliberate and decide on the best line of approach. Now, the patient has to be involved every step of the way. It is the patient's right to know. Your doctors cannot just go somewhere, make decision on what to do for you, and then not just come and say without getting you involved. All right. For instance, we have cases of some patients who have cancer. All right, and the doctors have planned, okay, this is what we're going to do for this very patient. The patient has to be carried along. Maybe they want to go in for chemotherapy, they want to remove the cancer. The patient has to be carried along. Okay, if I'm to go for chemo, these are the possible side effects. This and that and that and that. It is the right of the patient to be carried along in the decision-making process. And the patient say, okay, no, I want to seek for second opinion. Let me know what other experts in other facets are going to say. It's also the patient's right for such to be done, for the patient to seek for, second opinion. Right number 8. It is the patient's right to express personal, ethnic, and religious beliefs. Yes, it is the patient's right to express personal, ethnic, and religious beliefs. Imagine you came to a hospital and they are telling you, no, ma'am, you can't pray here, okay, or you can't do certain things, and these are things that you believe in. They will be stepping out of line. Okay, it is the patient's right to express his personal belief, his ethnic belief, and his religious belief. If such beliefs are out of line with the medical treatment, okay, the hospital can decline treating such patient, maybe refer to other facilities that are comfortable with such. But it is the patient's right to express those beliefs. But in instances where those beliefs are contrary or counterproductive to what is being done in the hospital, it now behoves on the hospital to explain sufficiently to the patient. And if the patient still declines or wants to continue in that state of belief, then the hospital can say, okay, we can't continue because continue like this, we put you at more risk or more harm. So it's better we refer you to so and so facility that may attend to you the way you want. Right number 9, right to know the names and qualification of attending healthcare personnel. It is the patient's right to know who is attending to them, to know who is doing what for what. Okay, for instance, as a doctor, if a patient asks me, okay, doctor, what is your qualification? It is the patient's right to know. I will say, okay, I am Dr. Emmanuel Okore, I am this and that and that. Now, this is important because there are facilities that, employ quack. In such a facility, if the patient now asks, okay, what is your qualification? I hope they will be bold enough to say, no, I'm untrained, I'm a quack this, I'm a quack doctor, I'm a quack nurse, right? So it is the patient's right to know. I've had people asking me, okay, are you a consultant? So I say, no, I'm not yet a consultant. I am this and that. Okay, it is the patient's right to know. Now, imagine in a healthcare facility, a patient now inquires to know the qualifications of his or her caregivers, and they snub her and say, what? That would be highly unprofessional. So the patient has to know the qualification of those who are attending to him or her, especially if they ask for it. Right number 10, right to access medical records after appropriate payment has been made for the photocopying or for the printing. Okay, now remember we said something about confidentiality and privacy and all that, but in this case the patient have a right to access his or her medical record, to access his or her medical information. Okay, now the hospital may say, and before we provide these services, now you have to pay for the print, you have to pay for, so it's all right as long as they allow the patient access to the medical record. So it is the patient's right to have access to their medical record. Having stayed through till the end, let's just take a quick recap. First is right of access to medical care. Second is right to be treated with respect and dignity. Third is right to privacy and confidentiality of information. Number 4 is right to be informed of the diagnosis, the treatment plan and prognosis, as well as the cost implication. Right number 5 is right to be informed and consent taken before any procedure. Number 6 is right to know the safety dosage and potential side effect of any medication. Right number 7 is right to be involved in the decision-making process. And number 8 is right to express personal, ethnic, and religious beliefs. While right number 9 is right to know the names and qualifications of your caregivers. And finally, right number 10 is right to access your medical record. Next week, we'll be discussing the responsibilities of a patient. If you have not subscribed to this channel yet, kindly do so. Subscribe to this channel and activate the notification bell so that you'll be updated whenever we make a post. And please, kindly share this post and invite your friends to like our page. Thank you.